Good day everyone, I'm Angeline Monteza and I'll be discussing the major infections and examples of sexually transmitted diseases or STDs. But first, I will define what sexually transmitted diseases are. Sexually transmitted infections, STIs, also referred to as sexually transmitted diseases or STDs, and the older term venereal diseases, according to Wikipedia, are infections that are spread by sexual activity, especially vaginal intercourse, anal sex, and oral sex. So first, what is sexual activity? Human sexual activity, also known as human sexual practice or human sexual behavior, is the manner in which humans experience and express their sexuality. Sexual activity usually results in sexual arousal and physiological changes in the aroused person. These activities involve physical intimacy between two or more individuals and are usually among humans solely for physical or emotional pleasure and can contribute to human bonding. STDs often do not initially cause symptoms, which results in a risk of passing the infection onto others. Symptoms and signs of STDs may include vaginal discharge, penile discharge, ulcers on or around the genitals, and pelvic pain. When we say vaginal discharge, it is a mixture of liquid, cells, and bacteria that lubricate and protect the vagina. This mixture is constantly produced by the cells of the vagina and cervix, and it exits the body through the vaginal opening. What is penile discharge? When we say penile discharge, it is fluid that comes from the urethra at the end of the penis that is not urine. What are ulcers on or around the genitals? A genital ulcer is an open sore located in the genital area, which includes the vulva, penis, perineal region, or anus. Genital ulcers are most commonly caused by the infectious agents. However, this is not always the case, as the genital ulcer may have no infectious causes as well. What is pelvic pain? Pelvic pain is a pain in the area of the pelvis. Acute pain is more common than chronic pain. If the pain lasts for more than 6 months, it is deemed to be chronic pelvic pain. It can affect both the male and female pelvis. Some STDs can cause infertility. When we say infertility, it is the inability of a person, animal, or plant to reproduce by natural means. Bacterial STDs include chlamydia, gonorrhea, and syphilis. What is chlamydia? Chlamydia, or more specifically a chlamydia infection, is a sexually transmitted infection caused by the bacterium Chlamydia trachomatis. Most people who are infected have no symptoms. What is gonorrhea? Gonorrhea, colloquially known as dicula, is a sexually transmitted infection or STI caused by the bacterium Neisseria gonorrhea. Syphilis is an infection transmitted through sexual contact caused by the bacterium Treponema pallidum, subspecies pallidum. The signs and symptoms of syphilis vary depending on which of the 4 stages it presents. Examples of viral STDs are genital herpes, HIV or AIDS, and genital warts. Parasitic STDs include trichomoniasis. STD diagnosis tests are usually easily available in the developed world, but they are often unavailable in the developing world. When we say genital herpes, it is an infection by the herpes simplex virus or SSV of the genitals. Most people either have no or mild symptoms and thus do not know they are infected. HIV or AIDS are a group of diseases caused by infection with the retrovirus or HIV. Following an initial infection, an individual may not notice any symptoms or may experience a brief period of influenza-like illness. What is genital warts? When we say genital warts, it is a sexually transmitted infection caused by certain types of human papillomavirus. They are generally pink in color and project out from the surface of the skin. They usually cause few symptoms, but they can be painful on occasion. What is trichomoniasis? Trichomoniasis is an infectious disease caused by the parasite Trichomonas vaginalis. About 70% of affected people do not have symptoms when infected. When symptoms occur, they typically begin 5 to 28 days after exposure. Symptoms can include itching in the genital area, a bad-smelling, thin vaginal discharge, burning with urination, and pain with sex. Having trichomoniasis increases the risk of getting HIV or AIDS. It may also cause complications during pregnancy. There is often shame and stigma associated by STIs. The term sexually transmitted infection is generally preferred over sexually transmitted diseases or venereal disease, as it includes those who do not have symptomatic disease. That would be all. Thank you, and God bless us all.